So minimal residual disease, and as many of the experts in the field have said, should be known as measurable residual disease, is trying to detect the leukemia that's left behind after your initial therapy, which is typically these days is cytotoxic chemotherapy. And obviously this is a disease that has shown resistance to cytotoxics. And so there has been a wealth of knowledge developed over the last 2 decades that shows that this is a very significant predictor of outcome. And it obviously makes sense, because when you have residual disease after your therapy, it means that this is a particular population that's not sensitive to the therapy you've just given the patient. So better identification of this population of residual disease and use of better drugs to eradicate it is the future. These drugs obviously also have to be relatively non-toxic and well tolerated by the patients, because if the patient with acute leukemia has just received several months of cytotoxic chemotherapy and they're in remission and they don't know how long they have to live, the last thing they want is to receive toxic, poorly tolerated agents for the next several months of their life. So fortunately, we now have such drugs available, relatively non-toxic, target-specific drugs that we can use in the residual disease setting and to try to eradicate it. However, all of this needs to be standardized, and in order to actually have meaningful data, we need to have large studies of these agents.